what's happening with U.S. troops in Niger, and a rare proposal for American troops to counter threats from Iran. All that and more today, August 4th, 2023. Good morning, early birds. I'm Zimone Perez, and this is the Early Bird Brief, produced by Defense News and Military Times. First up, Marine security guards stationed at the American Embassy in Niger will remain there as the United States evacuates all but essential staff. That's because of the recent military takeover of the African country. The State Department on Wednesday ordered the temporary departure of non-emergency personnel and eligible family members from Niger. State Department spokesman Matthew Miller said the embassy in Niger's capital, Niamey, remains open.
I will say that the U.S. Embassy in Niamey is open. We intend for it to remain open. We remain committed to the people of Niger and our relationship with the people of Niger.
Last week, Niger came under military rule after democratically elected President Mohamed Bazoum was overthrown and held captive by members of the country's presidential guard. Here's why it matters. Niger is home to an American military base, and there are currently more than 1,000 U.S. military personnel in the country. Troops in Niger have helped the country's armed forces in counterterrorism training in the past. Niger also receives millions in military aid each year from the United States. Security cooperation has been paused in the country as the coup continues. Chairman of the Joint Chiefs of Staff, General Mark Milley, has been in contact with his Nigerian counterpart to assess the status of the rest of the government and armed forces. Pentagon Press Secretary Air Force Brigadier General Pat Ryder said in a statement there are no changes to the U.S. military force posture in Niger. France, Italy, and Spain previously announced evacuations from Niger for their citizens and other European nationals. National Security Council spokesman John Kirby said there were not currently plans for American troops to help other countries evacuate.
There's been no decision to use them in any way to support evacuation efforts by other countries, and there have been no decisions made about pre-positioning any additional forces in or nearby Niger for that purpose.
Another important story, officials said the U.S. military is considering putting armed personnel on commercial ships traveling through the Strait of Hormuz. That would be an unheard-of action aimed at stopping Iran from seizing and harassing civilian vessels. America didn't even take that step during the so-called tanker war during the 1980s. That culminated with the U.S. Navy and Iran fighting a one-day naval battle in 1988. That was the Navy's largest since World War II. Here's why it matters. The four officials offered few details on the plan, but it comes as thousands of Marines and sailors are on their way to the Persian Gulf. They're on both the amphibious assault ship USS Bataan and the landing ship USS Carter Hall. Those Marines and sailors could provide the backbone for any armed guard mission in the Strait. 20% of all the world's crude oil passes through the Strait. Iran's mission to the United Nations did not immediately respond to requests for comment about the U.S. proposal. The U.S. officials spoke on the condition of anonymity to discuss the proposal, and they stressed no final decision had been made and discussions continue between U.S. military officials and America's Gulf allies in the region. The U.S. has already sent A-10 Thunderbolt II warplanes, F-16 and F-35 fighters, as well as the destroyer USS Thomas Hudner to the region over Iran's actions at sea. In other news, the Department of Veterans Affairs will deploy 25 mobile medical units around the country to prevent veteran homelessness. For more on this, Military Times Capitol Hill Bureau Chief Leo Shane III joins the episode today. So, Leo, could you tell us a little bit more about these mobile medical units the VA is using?
Yeah, there are 25 of these mobile medical units that are going to be sent to various cities over the next 6 months, as you said, as an outreach for homeless veterans. These are actually larger vehicles that have space for some clinical work, some primary care, some mental health consults, and the technology for telehealth visits. And the idea here is just to get out in the communities, out in the streets, and actually give homeless veterans or veterans that are struggling an opportunity to get their medical care needs met without having to travel to a VA hospital or a VA clinic. You know, especially for folks who are facing financial problems or maybe experiencing homelessness. Just getting to the hospital can be a major problem. So this is just a way to get the services to them. They've done this in the past with benefit services in the wake of hurricanes and other natural disasters, or when they're trying to get rural veterans some more access. So it's not unprecedented, but this is a pretty big push by VA over the next 6 months to say, hey, we want to double down on our efforts and really make sure that homeless vets are getting the services that could help them.
And this kind of outreach seems to be a pattern for the VA as of late, doesn't it?
Yeah, look, it's pretty interesting. VA earlier in the week announced that they are expanding breast cancer screening for female veterans who are under 40 who had exposure to burn pits because of past research that shows a link between some toxic burn pit smoke and breast cancer. They just announced 3 new presumptive illnesses connected to the PACT Act. This is a sweeping benefits legislation that was passed last year for toxic exposure in the military. Announced 3 more conditions related to service in the Middle East and poor air quality and burn pits. VA over the last few months has really made this idea of outreach a major point and a major point of action for them too. Finding ways to send their personnel out into communities, finding ways to try and get more veterans in. And the thought behind it is, VA can only help the veterans it reaches. So if they can't get folks to come in, if they can't get folks to talk about what their problems are, what their challenges are, they can't find ways to help them. Part of that is regaining trust with these veterans. Part of that is, convincing these veterans that VA is there to help them, that they won't be facing cumbersome paperwork, where they won't be facing adversarial administrators who want to deny them benefits or who won't get them medical care. But it's been really interesting just over the last year or so to see how many more of these smaller projects aimed at building outreach and trust VA has really doubled down on.
Also on your radar for today, a search and rescue team from Able Air Station, Whidbey Island, Washington, helped rescue a hiker suffering from a broken ankle on the southern rim of Mount St. Helens last week. The Mount St. Helens Volcano Rescue Team contacted the search and rescue team late on July 26th, asking for aerial transport to help recover the 63-year-old hiker. The hiker was at an altitude of more than 7,500 feet. The search and rescue team arrived on the scene just after 1 a.m. on July 27th. The team then hoisted the hiker from the mountain and transported the individual to the ambulance crew less than an hour after arriving on the scene. The operation is one of 23 missions the search and rescue team from Whidbey Island has executed this year, including 1 medical evacuation, 4 searches, and 18 rescues. Naval Air Station Whidbey Island's search and rescue team operates 3 MH-60S helicopters. And now here are some other stories that we're hearing chirps about. U.S. officials said yesterday 2 U.S. Navy sailors were arrested on charges related to national security and tied to China. An officer said yesterday the team searching for an Australian Army helicopter that crashed at sea, killing 4 people during a training exercise with the United States last week, found human remains. They did not, however, find the black box crucial to explaining the tragedy. The Air Force expects to release its formal request for information for a KC-135 tanker recapitalization in September. That will pave the way for an official acquisition strategy for the program it previously referred to as a, quote, bridge tanker. And the Army's 18th Airborne Corps said yesterday an American paratrooper named Vincent Speranza, who became a legend in Belgium during World War II for carrying beer in his helmet to give to the wounded, has died. And on this day in history in 1914, President Woodrow Wilson formally proclaims the neutrality of the United States as World War I erupted in Europe. Of course, the United States would eventually formally enter the war 3 years later. That's it for us this morning. To get more top stories and breaking news, go to defensenews.com/EBB to subscribe to the Early Bird Brief newsletter. Please give us a like, rating, and a comment wherever you get your podcasts, and be sure to follow us on social media at @defense_news and @Military Times. The Early Bird Brief was hosted and produced by me, Zimone Z. Perez. Today's episode features stories by Irene Lowenson, The Associated Press, Leo Shane III, and Diana Stancy. Our editor-in-chief is Mike Bruce. Have a great day.